My hope for hip dysplasia is that when a patient makes the difficult decision to move forward with hip preservation or full joint replacement surgery, is that they understand eyes wide open that surgery is just one small piece of their solution, that most of the work comes after, via therapy, with the physical therapist, and beyond, to get them back to the activities and pain-free, or as close to pain-free life that they deserve.
My hope for hip dysplasia is that there's an increasing level of awareness of the condition, particularly in adults and adolescents, across the medical community, from physical therapists and physiotherapists, from your kind of everyday general practitioners and family doctors, right through to the orthopaedic specialties. I think there's a common story that certainly affected myself and a number of other people I know with hip dysplasia, where that delay and number of people that you have to see before you get the correct diagnosis can have quite a profound effect physically as well as mentally. So I would love to see that increasing awareness so that the time to diagnosis really drops and people are given the right treatment right from the start.
My vision for hip dysplasia is earlier detection and prevention.
Hi, my name's Sarah. I'm 36 years old. I've suffered with hip dysplasia for as long as I can remember. I was diagnosed at 14 and was told there was nothing that could be done. Fast forward, this is my x-ray behind me from 5 years ago. I now need a total hip replacement. My vision would be for people to be able to be diagnosed as soon as possible so they can be helped before they have the chance to reach the stage I am now at personally.
And my vision for hip dysplasia is to make the diagnostic process easier for the next person.
My vision for hip dysplasia. I wish that all patients, young and adult, have a timely diagnosis, are informed and understand their hip pathology. And once that diagnosis is made, the patients have a shared decision with their care provider on treatment options. And I hope that treatment provides the patient to remain active and pain-free.
I am passionate about hip dysplasia because I see firsthand the incredible impact that the ongoing research and procedures have on patients all around the world.
My vision for hip dysplasia is that there are more physical therapists that can treat the whole body and not just your hip, so they can look at how you compensated for your unstable hip and break those habits. There's nothing better than a really great PT to get you back to your goals.
My vision for hip dysplasia is that it becomes a diagnosis that is rarely missed and the delay for proper treatment is minimized.
My vision for hip dysplasia is that more surgeons are better educated in the diagnosis and surgeries to help correct hip dysplasia. So more fellowship training for the hip preservation surgeries so that we can all have great outcomes.
My vision for hip dysplasia is that we can improve education and awareness of hip dysplasia signs and symptoms among community providers, including physicians, physical therapists, athletic trainers, coaches, and all those folks who might encounter hip dysplasia patients before they've gotten a proper diagnosis. My hope is that by increasing this awareness, we can get patients referred to specialists in a timely manner, and they can get the proper diagnosis and get on the road with an appropriate treatment plan.
My vision for hip dysplasia is a world where everybody gets diagnosed when they should be, that every case is managed conservatively without having to need surgery, and that everybody who does have hip dysplasia has the support and awareness to get every bit of help that they possibly need.
Our mission at the International Hip Dysplasia Institute is to reduce the physical, social, and economic burden for children and adults affected by hip dysplasia.